Is overuse of strollers creating a generation of sedentary preschoolers?
Or are parents actually using those devices to get their children to places where they can actually engage in active play? As our health reporter Pauline Chan tells us, it's a question that's being raised by researchers at the Hospital for Sick Children.
This mom likes taking her daughter on long walks to see the city, and she does encourage her to get out and walk on her own.
I'd actually want her to walk, but she prefers to sit in the stroller.
And that's the concern raised by the American Academy of Pediatrics, which began recommending reducing the use of strollers. But Dr. Catherine Birkin from the Hospital for Sick Children wanted to take a closer look at the issue.
We wanted to go to parents and ask, how do you use your stroller? And do you think there's any connection between physical activity and stroller use?
A survey conducted with the help of families through the Applied Research Group for Kids found the main reasons parents use strollers is for transportation, storage space, supervision or confinement of the children, and to bring the children along during their own physical exercises. Dr. Birkin says parents generally didn't perceive any connection between stroller use and physical activity. And in fact, she said many parents said they use strollers to facilitate physical activity for their children.
So if they're using their strollers to transport children to places where they can't be physically active, that's fantastic. If they can allow their children to have opportunities to push the stroller or be outside the stroller or encourage more walking, that would also be fantastic.
Dr. Birkin suggests children should be ready to give up using a stroller altogether around 4 years of age, when they begin attending school. She says there's no hard and fast rule to follow, as long as parents keep encouraging kids to have an active lifestyle. And she says the best way to do that is for parents to be good role models themselves and walk as much as possible. Dr. Birkin says the next step should be to measure actual stroller use and evaluate how that affects children's habits as they get older. The study appears in the journal Biomed Central Public Health. With today's Lifetime, I'm Pauline Chan.